Similar medical procedures, same medical provider, but the bills are thousands of dollars apart.
A local man getting ongoing treatment brought that scenario to 10 on your side. It's our latest example of the confusing cost of health care. Investigative reporter Chris Horne looks into its case, as well as a new law designed to make medical pricing more transparent. Chris?
Anita's Stephen Milne says he demanded an explanation from Centera and is still waiting for an answer. Meanwhile, a new law that's supposed to remedy a convoluted system, little more than a pricing placebo.
Really shocked when I got the bill for what was a routine CAT scan.
Steve Milne of Carrollton has periodic CAT and MRI scans with Centera. In 2017, an MRI was billed before insurance at more than $4,300. A year later, he had a CAT scan, which generally should cost less than an MRI, and
I got a bill before insurance of $6,000.
And his out-of-pocket share this time was more than $2,100.
I just wanted an explanation. How could they justify those charges?
Centera's Dale Godding couldn't comment on a particular patient, but he says all providers negotiate price schedules with various health plans.
Sometimes prices grow as part of a contracted agreement. There is no universal pricing mechanism in healthcare.
A new law passed after Milne's treatment last summer forces providers to post their rates online. That'll make the whole process more transparent, right?
I think it actually brings more confusion.
The Patient Advocate Foundation and Centera agree the posted prices, also known as a charge master, are not a reliable guide.
They're scary high, and they represent the top tier pricing that almost no one really pays.
Just like if you're purchasing a car and the manufacturer stickered price is what the average price is, it's not reflected of any of the discounts or rebates.
If you have a health plan, you're not going to pay that much. If you're a self-pay patient without insurance, you're not going to pay that much.
Back to Stephen Milne. He was also getting IV treatments for an infection. 7 treatments, 15 minutes each session, just a nurse, no special machine.
So that's 105 minutes. And they charged me $1,500, and that was a service charge.
Some quick math now. $1,500 divided by 1 3/4 hours, that's $857 an hour.
Just the service charge. This was for the service of having a nurse.
The labor, so to speak.
That's right. That was pure labor because the drug charge was separate.
Centera says that service charge reflects the hospital's overhead for its 12 hospitals and more than 300 care sites. Godding says Centera spends $15.6 million every day just to keep the doors open. So as you probably already guessed, that nurse doesn't really get $850 an hour.
Both providers and consumers are frustrated with the cost of health care. It is one of the biggest complaints in America.
Not just one of the biggest for Milne.
Basically, I've decided that as soon as this is settled, I'm firing their butts.
I think it's up to consumers to pay close attention to their health plans and to their health plan design.
And providers must now post their rates, as we mentioned, but health plans must also have transparency tools so patients can get an idea of their bottom line costs. The Patient Advocate Foundation, however, says patients shouldn't rely solely on these online calculators. Your best bet is always to call your health plan to get the most accurate information about what a procedure will end up costing you. Chris Horne, 10 on your side.